welcome to our Provider Spotlight series. My name is Dr. Blair Green. I am a physical therapist and the founder of Catalyst Physical Therapy here in Atlanta. And this is our first Spotlight series. I am so excited today. I have with me Dr. Erika Pluhar, who is a licensed marriage and family therapist, a licensed professional counselor, and a certified professional counselor um, supervisor here in Georgia. But I think what's really interesting about Dr. Pluhar and why I brought her on today is she is also a certified sex therapist through the American Association of Sexuality Educators, Counselors, and Therapists. This is what is known as AASECT. It's an acronym, AASECT, if you are looking it up online. And she is the co-founder of Whole Heart Psychotherapy here in Atlanta, which is an amazing practice of counselors and therapists who work with a variety of different types of patients who have similar problems. So, Erika, thank you so much for coming on today.
Thank you for having me. It's an honor to do this with you.
Of course. So, I thought the best thing we could start out with is why don't you tell us a little bit how this is so fascinating to me, sex therapy? It was something I don't think I knew about until I met you. How did you get into this line of work? How did this all come
Yeah.
to be?
Well, so a couple pathways converging, I would say. In I had some experience doing family therapy with my family growing up, and I remember that kind of tipped my eye in the direction of therapy as a career. And then in college, I didn't know what I wanted to major in and decided to open the course book because it was all in an actual printed book at the time, aged myself, and take whatever courses jumped out at me as interesting and like as an experiment. And 3 out of the 5 had to do with human sexuality in some way. So I was like, I think I might be onto something. And then the more that I studied about it, the more I learned. And these were classes in like all different types of departments: psychology, sociology, anthropology, history, gender studies. So the more I learned, like the more curious I got. And I was like, wait a minute, why is this ubiquitous phenomenon of like sexuality, something that affects almost everybody, so taboo and so like weirdly untalked about, yet also celebrated and everywhere? So that paradox didn't make sense to me. And then I slowly started to become the person that people would ask questions of about sex and sexuality. I TA'd the gigantic human sexuality class at my college and loved it. I also, at some point during my college experience, went to see the sex and relationship counselor to ask some questions at my university. And I was like, oh, I want to do what she does. So all of those little things kind of pointed me in that direction. And then I went to grad school and to study more about human sexuality, but it was an education degree instead of a therapy degree. So I was trained as a researcher and an educator, and then had a 5-year short career after that in public health research, doing HIV/AIDS prevention research. And about 2.5 years in, I was like, wait, I think actually therapist, that's what I need to do. So went back for more grad school, mushed it all together, and became a sex therapist.
Wow. What an interesting path. And I have to laugh because when I was in school, also things were in books. So,
I know.
so I learned that way. I
Similar
learned that way as well.
generation. Uh-huh.
Yeah, but having said that, like obviously you're very much a pioneer in this industry, especially locally, I would say. How has your practice grown? Can you tell us a little bit about Whole Heart Psychotherapy and maybe a little bit about your personal practice, but also your group and how you guys have grown over the years?
Sure. Yeah, when I started out almost 20 years ago, there were, I think, 6 certified sex therapists and 1 pelvic floor physical therapist. And that person didn't even do like manual hands-on work. It was all just biofeedback. So a ton has changed. There are now, I think, 2 or 3 pages of certified folks on the AASECT website. And I'm super, super humbled and proud to have trained a number of them and done supervision. And so my practice started out in, I was just working with another practice that specialized in relationship and sex therapy, and did my like supervised experience there. And then as I grew and got my full license, I hung my own shingle and over a number of years, grew a full-time practice specializing in sex therapy, and eventually had more referrals than I could handle. And so I decided I wanted to get into supervision. I always did some kind of education, and at the time was teaching adjunct at Emory in public health, and also at Argosy University. I was teaching human sexuality there and research methods. And so that like teaching part of my identity was still going, and supervision really seemed like a great way to honor the teaching part. And so eventually I brought on a supervisee and an associate in my practice, and then started growing it that way. And then in 2013, my business partner, Dr. Tara Arnold, and I, we were both in similar places of growth at the same time. And we decided, let's join forces and start a psychotherapy group practice. So we did. And I've always had we say we have like 2 divisions, mine, which is the sex and relationship therapy side of things, and hers, which is eating disorders, body image, and DBT, dialectical behavioral therapy. So that's been us ever since, 12 years. And we have a building here in Buckhead at Lenox Point. We have a lot of different therapists that specialize in different areas and also provide general individual relationship, family therapy. Of course, we have the sex therapy team, and then she's got folks that do radically open DBT, which is like for over-controlled individuals, as well as traditional DBT, skill set for emotional regulation. She's got individuals and groups, and body image groups. So a lot going on here at Whole Heart.
Yeah, tons of stuff.
Yeah.
So personally, what types of like people do you like to work with? What's like your ideal client?
That's evolved over the years. I really do still enjoy working with one of the most common presenting concerns in relationship and sex therapy, which is desire discrepancy, or being sexless, or low sex, no sex relationship. So at some point along the way, the physical part of the relationship kind of gets stuck or falls off, and one person is more in the higher desire place and the other is in a lower desire place. And that often corresponds with big life transitions, like getting, formally partnered or married, having children, of course, aging, perimenopause. That's kind of more my jam right now because of lived experience.
That one.
So, that all, like, sexuality is mind, body. And so anytime there's things going on in the body, like, it's going to affect sexuality. And then you get relationship dynamics around that, or the relationship dynamics are already there that inform the sexual dynamics. So like teasing all of that out, and helping people be able to communicate openly and vulnerably, and like cut past these really rigid, stuck communication patterns so that they can be more open-hearted in their communication, and then rebuilding their sexuality for whatever that's going to look like in this chapter. That's kind of my sweet spot. But I and my associates work with the whole range of sexual concerns. So healing sexual trauma, anorgasmia, difficulty orgasming, erectile difficulties, what am I forgetting? Pain with sex. That is a major subspecialty. That's why we even know each other. And that kind of overlaps too with like the medical pieces we were talking about, or when somebody is having pain with sex, a lot of times they stop eventually having sex or any kind of physical touch. So helping relationships rebuild that, and like what can our physical touch menu look like now, given that we have these physical challenges or we've had this trauma in the past or whatever it is. Infidelity recovery, consensual non-monogamy. Many of us work with folks who are polyamorous or some form of consensual non-monogamy, kinky people, people with discrepancies in those arenas, one that's kinky and one that's not, or one that's monogamous and one that's not. So, yeah.
You work mostly, I know that a big piece of what you do involves working with partners if there is
Mhm.
a relationship there. But a lot of what you do is individual, or is it more couples?
Both. So we all everybody on my team sees individuals as well as relationships, and it kind of depends on the case. Like if somebody um, is coming in and saying, I'm in this relationship and sex has become a stuck point and we're not having sex anymore. Usually it's, let's see if we can get the relationship in the room and get you two talking, because there's a dynamic going on between the two people. Sometimes the person just wants to talk individually. That's what they're comfortable with at that point. So like we have to clinically decide what makes the most sense. And we always do that in a free telephone consultation at the beginning, as well as in our intake process, figure out like what's the best treatment structure.
Gotcha. So what can patients expect like after working with you? Is this more, I know obviously it's different for everybody. So some people it's probably a short-term relationship. For others, it might be long-term, very similar to what we do. I have my lifers, my people who stay with me forever, who I love dearly, but others don't need that kind of care.
Yeah.
What can people expect after working with you? Like what
Yeah.
does that look like for them?
There's a great little acronym in our field called the PLICIT model, and it's been around since the 70s, and it I think helps delineate the different types of work. So PLIS stands for permission, limited information, and specific suggestions. And that's generally what sexuality educators, counselors, do in a more like short-term clinical setting. And then therapists, we do that too, as well as the IT, the intensive therapy. So a portion of our clients are going to be coming in and just needing like some basic resources and permission. And I mean, it's really hard to grow up in this society and not get some form of shame or secrecy or trauma around sexuality infused in our narratives about what sexuality is. So sometimes it's just like de-shaming and giving permission and, hey, read this book, and here's a few behavioral things that you can try with your partner, and people are on their way. I would say more off it, when I started out, there was so much less permission around therapy 2 decades ago, let alone sex therapy. And so people were in much greater distress by the time they got to me, which meant we were doing a lot more of the IT part, like the intensive therapy, and people were in longer term therapy. Now people are kind of catching things earlier,
Yeah.
um, which, I don't have the hard data on this in our practice, but in theory, it would mean that they need to be in therapy less time.
Right.
Um, it just depends. We all are very attachment oriented in our training and theoretical orientation, which means, tending to the bonds between the relationship partners and also the bond between the therapist and the client. And so that can mean that we have a relationship for a long period of time, and maybe there's an active therapeutic piece of work at one point, and then people fall off and they come back when something changes in their life or another challenge crops up.
Right.
So
Yeah, I think you bring up a good point though too, is that access is so much, A, it's easier, and
mhm.
B, I think it's more socially accepted. So
Yeah.
people are coming sooner, which I do think, I mean, it's the same with PT. I do think it helps curb some of the problems a little bit because if you just have questions or you just want to learn, you can. And I think to your point, sexuality, sex in general, gender issues, those things, while they still are very taboo and not talked about enough, I think
Mhm.
it's changing. I think it more and more people are feeling more comfortable bringing it up in public and private
Mhm.
situations to where people would be able to come and get help sooner. So I
Yeah.
know in my line of work, it's a lot easier now than maybe it was 10 or 12 years ago to say, hey, I want you to go talk to this person. It's almost like part of the plan. We're doing all the hands-on stuff, and then it's like, but we need to address these issues as well. And, whether it's relational issues, whether it's kind of cognitive behavioral things that they can
Mhm.
do. And I think it makes a big difference to be able to say, hey, I want you to go see this person. And like 10, 12 years ago, people looked at you like you had 10 heads. If you were like, what, you want me to see a psychotherapist? Like, what's going on here? I'm not
Right.
crazy. And now it's just sort of part of the plan of care. So,
Yeah. And I
um,
feel the same way about PT, like pelvic floor PT. 10
yeah.
years ago, I would have to do a whole lot more education about I've been in their offices and this is what and it's legitimate. And now like people are often we get referrals from y'all. So
Yeah. Yeah, it's really great. So last question to finish this up. What is one thing you would want potential clients to know about you? And that could be personal, professional, like someone's going to come see you. What's one thing you want them to know about you?
mm, um I am going to do my very, very best to make the safest space possible for you to be brave in. So, and for us to be courageous together, about encountering new aspects of emotion, your relationship. And that's going to include a good sense of humor, because I like to bring humor to my work and some active, directive approach, as well as really deep empathy and listening. So, and those are kind of the ingredients for relationships in general. And I think all
Yeah,
of our therapists here embody those components. We really love and enjoy relating and helping people relate more and more intimately and vulnerably. So,
awesome. I
yeah.
love it. That's great. I love the humor too. Have to throw a
Oh,
little
yeah.
humor in
What would
there.
we do without it?
I'm learning every day. Learning every day. So thank you so much. This was great.
Great.
And I will make sure that people have access to your information. We will go ahead and link your website and your contact info. So thank you, Dr. Erika Pluhar. It was great.
Thank you so much, Dr. Green.